One of the most common questions I get from military veterans about, hey, could this be considered a secondary injury? Especially one injury secondary to another. The question is about the neck and the back. Basically, the veteran wants to know if a neck condition like degenerative disc disease could be granted service connection as secondary to a lower back or lumbar spine injury or condition. So I want to talk about my perspective of that as an orthopedic surgeon in this video. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help veterans by writing Nexus letters that argue that your orthopedic injuries are connected to your military training and service so you can get the compensation you deserve. This video is the latest in a new series of videos I'm making in which I answer service connection questions that I receive from military veterans across the country. And the question, it's one of the most common ones I get from military veterans. Can a neck injury be caused or can be considered secondary to a lower back injury? And they're basically service connected for maybe it's a degenerative disc disease or IBDS or spinal stenosis of the lumbar spine, and they want to claim their degenerative disc disease of the cervical spine as secondary to the back. Here is my perspective on that. Could it be considered a secondary? Yes. There are one or two studies that show that, and it's sort of reciprocal, that there's an increased risk of degenerative conditions of the neck with low back pain or lumbar spine conditions and vice versa, increased risk of lumbar spine. It's not a significantly increased risk, but there is a little bit there. That it is a very tough argument to make. And I have seen, again, the vast majority of veterans that reach out to me do it after they've already been denied. They've filed a claim, they got denied. So now they come to me as somebody with more credentials and expertise than their C&P examiner and try to see if I can help them win. So I have read a ton of denial letters where the veteran tried to claim cervical spine secondary to lumbar spine and vice versa. Here's what I'll say, and I'm sort of guessing on the numbers, but I think what I'm saying is generally true. If you were to ask 10 orthopedic surgeons that question, could a neck degenerative condition be coming from or be caused by the lower back or considered secondary? Maybe 50-50 would say yes, maybe less than 50-50. That's a tough argument to make. And as an orthopedic surgeon, I don't know how confident I would feel in it. Yes. And the VA likes to say there's the thoracic spine in between separating it. It'd be a tough argument to make, quite honestly. You might win it. And again, you could rely on those studies that show increased risks or associations, but it would certainly not be a slam dunk. So I tend to like to file claims of cervical spine conditions, again, degenerative disc disease, facet osteoarthritis, spinal stenosis, and maybe subsequent cervical radiculopathy as primarily caused by the physically demanding military duties and activities. So primarily caused by the service rather than as a secondary injury. But could it be done and could it potentially win? Yes, it's just not going to be a slam dunk argument by any means. All right, I have written an ebook that you can have absolutely free. It's the 8 most common reasons the VA denies service connection for these claims and how you potentially can beat those. You can get a link to that free. Just click the link in the description under this video at near the very top of the page. You just enter your name, enter your email address, and I'll send that out directly to you. Also, please subscribe to this channel. You can click the bell to be notified when I release new videos and when I start my live show, Veteran Nexus Letter Live. Very fun. Definitely join for that once a month show. If you're interested in a Nexus letter, DBQ, TDIU letter, whatever it is for your injury or condition, you can click that link as well, scroll a little further down, and you can learn more about working with me and working with my team. We try to make the process easy. We try to make it quick. And I really try to write letters and do work that gives you the best chance of success in your claim. Thanks for watching, and I look forward to helping you.